Well, to talk more about the strike today, let's bring in Bénédicte Paviot in London. Bénédicte, what more can you tell us?
Well, it's clear that it's an increasingly bitter battle between nurses and the government. They're not the only ones, but let's concentrate on these fresh strikes today and tomorrow, so they'll have a greater impact because it's 2 consecutive days across England. You've got 1 out of every 4 hospitals and community services that will be affected by the walkouts. That's the estimate of the Royal College of Nursing members who are on strike here. It comes after 2 days, as you said, of strikes before Christmas in the pay dispute, the first in their history, so in over a century. As required under trade union laws, there are emergency provisions. Emergency care will be provided during these walkouts between 8 a.m. local time and 2000 hours. But it will mean that services such as chemotherapy, kidney dialysis, and intensive care, therefore, will be provided. And of course, as I said, emergency care. Now, during last month's action, we saw that thousands of treatments and appointments had to be rescheduled. Now, the Secretary General of this union, the Royal College of Nursing, Pat Cullen, who represents more than 300,000 nurses, she said that the union clearly regrets the impact it is having on these appointments and across the National Health Service. She said people aren't dying because nurses are striking. Nurses are striking because people are dying, she says. And she says that's how severe things are in an NHS that is absolutely in crisis. So there is a real problem here because there is a stalemate in the negotiations. The government will not accept this pay rise asked by the RCN. The RCN's asked for a pay rise of 5% above the retail prices index, a rate of inflation which currently stands at 14%. And what the government says is that actually that would help if all sector pay workers got a rise, then that would help to get inflation up further.
Well, Bénédicte, what is the support like generally for this strike? Because, of course, there are other strikes going on in the UK and have been for months.
Yes, there are other strikes. Let's just mention that there are more strikes planned for the nurses on the 6th and 7th of February, so the stalemate is clearly there. The support is clearly there. Also, we see in polling 45% of the public actually support this nurses' strike, 30% are against. But actually, those figures have lowered. It was greater support actually before Christmas, so we'll have to see how that goes. We already know that ambulance staff and physiotherapists are planning to strike in the coming weeks. We've had postal strikes. They are set to continue. We've got hundreds of thousands also across the public sector of train drivers who also want a pay rise, university lecturers, border staff. So very many sectors, different jobs across the public sector who are really worried and who have a job but don't know how they're going to pay the bills because of this very high inflation. So a real stalemate between the government and those workers so far.
Bénédicte, thank you for that. France 24's Bénédicte Paviot reporting from London.